In this video, we will describe the Pediatric Appendicitis Grade or PAG and provide instructions on how to assign a PAG during a laparoscopic appendectomy on a pediatric patient. Appendicitis is the most common cause of acute surgical admission and urgent surgery in children. The disease is typically described, treated, and reported in outcome studies as a binary one, simple versus perforated. However, it is well known that the disease presents in a wide spectrum, from simple inflammation to abscess formation with extensive contamination and generalized peritonitis. Unfortunately, we still do not routinely use any risk stratification in the diagnosis, treatment, or reporting of this disease. A widely used risk stratification system for pediatric appendicitis, similar to the Hinchey score for diverticulitis or the AAST score for adult appendicitis, would have several advantages. One, it will allow the surgeon to anticipate outcomes based on disease stage and appropriately set recovery expectations for patients and families. Two, it will allow anticipation of the resources that will be required for postoperative treatment. Three, very importantly, it will allow appropriate benchmarkings of outcomes in comparison to other surgeons and other institutions. Four, it will allow the accurate assessment of outcome publications on pediatric appendicitis by risk stratifying the presentations. Five, finally, it will allow appropriate definition of the healthcare cost burden for treating each stage, critical for third-party billing and reimbursement.
The Pediatric Appendicitis Grade, or PAG, was developed to allow such risk stratification. It takes into account the three most important determinants of patient outcomes: perforation, abscess formation, and generalized peritonitis. For perforated appendicitis, it has been shown in a previous prospective study to strongly correlate with outcomes and resource utilization. Specifically, the higher PAG grades are strongly predictive of the development of a postoperative abscess. The PAG is very easy to assign in the operating theater, as you will soon see. And finally, the PAG has shown a strong inter-rater correlation in a large international study performed in diverse practice settings in 8 countries on 6 continents. To assign the PAG, we first divide the abdominal cavity into 6 regions as shown here: the right upper quadrant or perihepatic space, the left upper quadrant or perisplenic space, the right paracolic space, the left paracolic space, the small bowel or interloop space, and the pelvis. The surgeon examines each of these regions.
The PAG is defined as shown here. PAG 1 is an acute non-perforated appendicitis. PAG 2 is a localized perforation without an abscess or generalized peritonitis. PAG 3 is a discrete abscess defined as a pus-containing cavity that does not communicate with the peritoneal space. This has to be disrupted and drained by the surgeon. PAG 4 is extensive contamination involving 3 or more of the 6 regions, resulting in generalized peritonitis. And PAG 5, the most severe grade, is a combination of PAG 3 and PAG 4.
This is an example of PAG 1, or acute appendicitis without perforation. We can see an inflamed appendix adherent to the ileum. There is no contamination in the right lower quadrant. There is also no contamination in the pelvis. Once the appendix is mobilized, both surfaces are examined. The appendix is clearly inflamed but does not contain any holes. This is an inflamed appendix without perforation, abscess, or peritonitis, assigned a PAG 1.
This is an example of PAG 2, a contained perforation without abscess or generalized peritonitis. On entry into the abdomen, we see purulence in the pelvis. The appendiceal inflammation is contained with omentum, and on dissection, a clear perforation is seen in the proximal appendix. However, there is clearly no contamination in the bowel space. As we survey the abdomen, we see no contamination in any of the quadrants. The purulent collection is limited to the pelvis. Therefore, this is a perforated appendix without abscess or generalized peritonitis, assigned a PAG 2.
This is an example of PAG 3, a perforation with abscess but no generalized peritonitis. In this case, on entry into the abdomen, we see purulence in the right lower quadrant and an appendix stuck in the pelvis. As we work to mobilize the appendix, we break into a discrete collection of contained pus, i.e. an abscess. A survey of the abdomen shows no evidence of peritonitis in any of the other quadrants or the bowel space. Therefore, this is a perforated appendix with an adjacent abscess, but no purulence outside the right lower quadrant and pelvis, assigned a PAG 3.
This is an example of PAG 4, a perforation with generalized peritonitis, but no abscess. On entry into the abdomen, we immediately see pus in the left upper and right upper quadrants. There's also pus around the sigmoid colon in the left lower quadrant, as well as pus in the pelvis. The right lower quadrant clearly has evidence of perforation. But as we dissect the appendix to reveal the area of necrosis and perforation, there is no abscess. Therefore, this is a case of perforated appendicitis with diffuse contamination or generalized peritonitis, but no abscess, assigned a PAG 4.
This is an example of PAG 5, a perforation with both abscess and generalized peritonitis. On entry into the abdomen, there is clearly significant perihepatic purulence. We also see purulence and a severe inflammatory process in the right lower quadrant, extending into the pelvis, as well as in left lower and left upper quadrants. There is pus and fibrinous exudate between the bowel loops. In this patient, no abdominal region is spared. As we mobilize the bowel loops from the pelvis, a large pelvic abscess is identified and evacuated. The appendix is finally mobilized out of the pelvic abscess cavity. This is clearly a perforation with a large pelvic abscess and generalized peritonitis, assigned a PAG 5.
Thank you for watching this instructional video. We believe routine grading of appendicitis using the Pediatric Appendicitis Grade or PAG will allow you to better counsel your patients, benchmark your outcomes, anticipate complications of the disease, and assign appropriate resources to children with appendicitis.